Hello, my name's Adrian Richards. I'm a plastic surgeon, and in this video I'm going to be talking about the recovery period following brachioplasty. So I've talked about in the previous videos about liposuction as an option if excess fatty tissue under your skin is your main problem, and also the different types of skin excision brachioplasties you can have. Now, whichever procedure you have, it's important to wear a compression garment following the surgery, and these normally, there's lots of different makes, but normally they're elasticated. You need to be measured for them, so they come in a lot of different sizes, and you need to have measurements of your arm to determine which one would be best for you. And normally either when you wake up from surgery or the day afterwards, you'll be fitted with this garment, which will produce gentle pressure on the arm to reduce swelling, and also the risk of you collecting a little pocket of fluid in the incision. And this area of fluid which can occur is known as a seroma, and a seroma is just a collection of serum, which is your body's own fluid. If you do develop a small seroma, which is almost a sort of a little balloon full of your body fluids, this may need to be drained off by your surgeon following surgery. So generally most plastic surgeons feel that gentle compression on the arm helps swelling and aids recovery, minimises bruising, and also the risk of you developing a seroma. If you've had liposuction, normally those incisions won't be sutured. Studies have shown that just leaving them open to drain off the fluid and allowing the very small incision just to contract naturally gives the best scar. So you may have little dressings on the incisions, but don't need any stitches removed. If you've had a type of excisional brachioplasty, so if you've had skin removed, the area will have been stitched by your plastic surgeon, and there's an awful lot of different types of suturing that you can have. And probably the most common is what's known as a subcuticular stitch. This is where the surgeon stitches up the tissue deeply with stitches you shouldn't really see, but then runs a very fine skin, rather like a sort of snake or a worm, underneath the skin, so from side to side, but it's buried and you won't see it. The only bit that you will see is on either end normally, where the end of the resorbable stitch will need to be trimmed. So most plastic surgeons, this is certainly what I would do, would arrange to see you the week following surgery, just to check the areas are healing and to either trim or remove any stitches you need removed. And probably most surgeons would also recommend that you continue wearing the compression garment for about 6 weeks following surgery. Regarding activities, it's important to keep your hands moving and mobile in the first week. Just concentrate on keeping those hands mobile, keeping your limbs going. And then in the weeks following that, you just need to sort of concentrate on lifting your arms, building up mobility. If you're in a desk job, probably a week off following surgery is adequate. But if your job does involve lifting or any sort of manual tasks, 2 to 3 weeks, I would have thought you would need before commencing these. Gym activities, you could go back to lower body gym activities after a week. Upper limb exercise, weights and things, you probably need to leave it for about 4 weeks following the surgery. If you've had excisional surgery, excisional brachioplasty, but you could probably get back gentle exercise after liposuction after a couple of weeks. So I hope that's been useful and informative. If you'd like any more information about brachioplasty surgery, please email us. We'd be happy to give you an honest reply to any of your queries. And if you want to send us any pictures of the areas that concern you, again, we'd be happy to have a look at these and give you an honest opinion as to which treatment would be best for you. So thanks very much for watching the video. We hope you'll be able to watch more in our series. Thanks a lot for watching.